Thank you, Mr. Speaker. I rise pursuant to Standing Order 53-1 to seek a statement from the Standing Committee of Health on Health regarding enrollment of residents of Mandera County to National Health Insurance Fund and release of capitations to hospitals in the county. In the statement, committee should, 1, find out and report to Senate the number of residents of Mandera County who have enrolled in National Health Insurance Fund, stating distribution in enrollment in NHIF in various demographics. Secondly, provide list of credit NHIF hospitals and health facilities in Mandera County for both outpatients and inpatient medical services. Thirdly, state capitation amount paid to public and private facilities, private health facilities registered with NHIF for service rendered to patients for the last 3 financial years to date. Give reasons for instance of delays by NHIF in releasing funds to health facilities. Finally, Mr. Speaker, state measures, if any, put in place to ensure there are no delays in releasing capitations to NHIF credited health facilities in Mandera County. Thank you.
Clerk, this is a technical hitch. I cannot see any of the senators who would wish maybe to. So how do we get to know? Senator Chiranke.
Mr. Speaker, I want to congratulate Senator Mariam Omar, one of my committee members, for this statement. I think the issue of universal health care, Mr. Speaker, is very critical. As Kenya Kwanza, the government has a plan on the issue of universal health coverage. And Mr. Speaker, the issue of NHIF should be available and accessible to every Kenyan. Mr. Speaker, everybody is aware on the 4th schedule that one of the important things and one of the key functions is on the issue of health, Mr. Speaker. So when you talk about the issue of NHIF, I know NHIF is trying to do its best in terms of revamping and making sure it is accessible, Mr. Speaker. And therefore, I want to call the Committee of Health to look at this matter. I've seen Senator Jackson Mandago, who is the chair of Health Committee, must look, and if there are any reforms that are needed within NHIF, Mr. Speaker, we must look at that properly, Mr. Speaker, because when you look at this issue of Mandera, it must be looked properly. And I hope with the new county government, now that county governments have settled, Mr. Speaker, we must be aware. And Mr. Speaker, we don't want to see a collusion between the county government, Mr. Speaker, and some busybodies within the NHIF who want to take advantage of that problem. And Mandera has more problems than somebody stealing or making sure they can access the NHIF card. As you are aware, Mandera is one of the counties, Mr. Speaker, that is ravaged by drought and famine. So if it reaches this level, Mr. Speaker, where the county government does not do its job, Mr. Speaker, then somebody must be called out. So I hope the Health Committee led by Senator Jackson Mandago will summon the Minister of Health, the CEO of NHIF must come, and the governor of Mandera must also come. And it is good the senator of Mandera is here, who is also the party leader, Mr. Speaker. The senator must also be there, Mr. Speaker, to look at this issue so that we have a closure on this matter, Mr. Speaker. And I think neighbors like Senator Dulo from Isiolo and all of us can be invited as a committee of the whole, Mr. Speaker, because NHIF is a national issue. So I want to thank Senator Omar for bringing this issue to the fore, Mr. Speaker. and call upon NHIF, even as we look at this in conclusion, Mr. Speaker. Can NHIF give us a short-term solution, Mr. Speaker? Because, you know, sickness does not knock on the door, Mr. Speaker. It cannot say today you will be sick, so you should be ready. So can the health committee, and I can see members led by Senator Mandago, give even, Mr. Speaker, with an indulgence on standing order number 1, can they even by next week, Tuesday, because this is an urgent matter, come even with a short-term solution on what can be done so that these NHIF card holders, Mr. Speaker, can still continue receiving medical care as we look into the issue. I thank you, Mr. Speaker, for that opportunity.
Senator Mungatana.
Mr. Speaker, I also rise to support Senator Mariam and support that it should go to the Health Committee. Mr. Speaker.
Senator Adulo, what is your intervention? What is your point of order? Proceed, Senator Mungatana.
Thank you, Mr. Speaker. Every time we hear issues to do with counties such as Mandera or Wajir or counties like Tana River, Mr. Speaker, we are always suffering from the same kind of issues of deficit in terms of government services availability. So, Mr. Speaker, I want to support my colleague here in how she sought this statement, and I'm asking the Health Committee to investigate about this universal health coverage